Heart failure hurts. Heart failure kills. Heart failure costs. Heart failure hurts over 140,000 Australians. It kills over 28,000 of us and costs $2.7 billion for the Australian healthcare system each year. People living with heart failure experience a high symptom burden, a poor quality of life, and multiple hospitalizations. Supportive care is an approach to improve the quality of life for people with heart failure. It is recommended alongside heart failure management that prolongs life. People with heart failure spend most of their time at home. When provided in the comfort of one's own home, supportive care has the potential to improve the well-being of those with heart failure. However, how to provide home-based supportive care in accordance with what matters to people living with heart failure and their carers remain elusive. My PhD aims optimize home-based supportive care by strengthening the voice of people living with heart failure and their carers. The first step was to find out what are the key components of home-based supportive care. The evidence showed that nurses, supported by a multidisciplinary team, providing symptom management, patient and care education, discussing goals of care are key components of home-based palliative and supportive care. The second step was to interview individuals with heart failure and carers to understand what they preferred for home-based supportive care. They preferred telephone support from a nurse practitioner. They preferred to have a dedicated place or person for all their heart failure-related needs. It was very important to them to have a good rapport with their healthcare providers. Support to understand their symptoms, disjointed communication and information were noted as areas for improvement. The third step is to present these findings at a workshop to those who are affected by heart failure and to those who can affect heart failure care, such as healthcare providers and policymakers, to compile a list of recommendations. The fourth and final step is to prioritize these recommendations in a 2-round survey. My PhD recommendations would guide policymakers to design a system that provides home-based supportive care, where the impact is to increase the uptake of home-based supportive care for people living with heart failure and their carers. This could unlock its potential to reduce patient symptom burden and improve their quality of life, so they may live life fully.